Wanted to talk today about the use of a fentanyl patch in end of life for severe chronic pain. We use it quite often in hospice when our patients are no longer able to swallow, or if or as needed medication is not holding them. So, things to consider is a fentanyl patch is a patch put on the skin, typically fatty tissue, so the medication has space to absorb. If it's over a bone, it's not going to really absorb. So we typically say put it in a fatty part if there are any fatty parts of the skeletal system left. Keep in mind, some of our patients are cachectic, meaning very, very little skin, and they could be skeletal. And in those cases, fentanyl may not be indicated. So, for the purpose of this, if somebody that comes on with pain, we would start with opiate, oral opiate. With disease progression and tolerance, meaning your body gets used to a certain dose and you need more for the same effect. Or if you're taking medications every 4 to 6 hours as needed, and at some point that was holding you, and now you really can't make it to that 4th hour, that would be called the end of dose failure. So we would increase the dose, the frequency, both. If we're taking as needed all the time, we would then try to go to extended release tablet, meaning starting at a standing tablet every 12 hours, then maybe every 8 hours standing. That's typically an MS Contin, also a strong opiate, and still have some breakthrough pain. If patients are unable to swallow any longer, sometimes morphine sulfate would hold them, and that's a very effective, a quick absorbing liquid morphine drawn up in a needleless syringe and administered buccally, meaning in your cheek pocket, so a very quick absorbing rate as well. But if we realize that we're using that every 4 or 6 hours, typically it's every 4 hours with the morphine as needed, then when you have an equivalent amount of opioids in your system, we might say, okay, a transdermal, a fentanyl patch, which is absorbed transdermally through your skin, would be indicated. So again, we want to make sure that we have the equivalent amount of opioids in your system before we put on a fentanyl patch. Fentanyl patch is very effective. We usually change it every 3 days. The caregiver would have to change it every 3 days. What I would say with that, with any opioids, well, the patch, use gloves. It's fentanyl. It could be very constipating. Senokot, if your person could swallow, if not, a bicycodal rectal suppository. It could cause stomach upset. We would use prochlorperazine or compazine if your person could swallow. Sofran has a rapid dissolve tablet, and there are compazine rectal suppositories as well. Things you need to know with fentanyl. Towards the end of life, your person could develop a fever. Typically doesn't mean an infection. What it does mean is your person is not able to regulate their own internal thermostat any longer. And that is not uncommon at end of life. What's important to realize with that is fever will cause vasodilation in your blood vessels, which could cause an increased absorption of the fentanyl. And we would need to know that, because that could be serious. We might need to lower the fentanyl dose. What else is there? No direct sunlight. You wouldn't expect somebody at end of life to be going out in sun, but you never know. So no direct sunlight. And this is a big one. No heating pad. Absolutely no heating pad on the patch. And no, I would just not put a heating pad anywhere near it, because again, that causes vasodilation. So I think that is what I wanted to get across as far as the use of a fentanyl patch. It is effective, but you do have to know some contraindications and when to call hospice. Hospice has a 24/7 number that you can call with any concerns, but with any fever, you do need to call us. That's important. So I hope this helps, and the more you know. We'll talk soon.